So I want to thank you for this opportunity to share with you a little bit about our programs at the Annenberg School, and I want to thank Ernie for this opportunity too. It's really great to hear from everybody. So basically, we have a family of programs here at Annenberg, and what they're about is improving and supporting the practice of health journalism so that we can, in turn, improve the health of communities. And we've really come to feel that journalism can actually be a kind of health intervention, and we'll talk about that a little more as we go. So I want to give you the nickel summary of our history and how we've built our family of programs. We began at Annenberg in 2004 with the support of the California Endowment. And basically, we started as a training program that was really focused on skill building for California journalists. And we've come a long way since then. The fellowships still lie at the heart of our work, but we're really working to get journalists to think big, to have a vision about what their work can be, its impact, whether they're advocating solutions, and ways to engage with their audiences. And we're tracking all that with work by an independent evaluator. And while we started with the California program and we continue to have one, we launched a national program in 2007, and then reporting stipend, two reporting stipend programs as well to support the work. And over time, we've built a journalism network of more than 600 people, all of whom have participated in our programs. And then we have 2,500 members of Reporting on Health, which is our online community and commentary site. And it's really a place where anyone can participate, they can share their story, they can debate and discuss. And it's not just for journalists. We feel like there's not so much value for journalists to always be talking to themselves, particularly as these walls between journalists and everyone else are, really collapsing. And so we have doctors blogging and researchers blogging and all kinds of voices that we're really quite actively bringing into the conversation. And we also wanted to leverage some of the networks that we have built. And so about a year and a half ago, we launched our first collaborative reporting project. And it brings together 6 news outlets who are all former fellows and their newsrooms. And that was focused on some health issues in the Central Valley, and I'll talk a little bit more about that later. And we're now in the middle of our second big reporting project that's a national collaborative project. And our final initiative is a community journalism hyperlocal project that's really a chance for us to see what we can do when it comes to engaging audiences, cultivating emerging voices of youth journalists, and really just connecting with audiences in different ways. And that's a project that we do in partnership with La Opinión and with the Boyle Heights Youth Technology Center. And it's basically operating in East LA. And we, through the partnership with La Opinión, distribute 22,000 copies of this print newspaper to the community. So it really is a community publication. So, we take to heart some advice that Eric Newton of the Knight Foundation has given to journalism schools when he said that journalism schools can be a lot like teaching hospitals or learning laboratories where we can really experiment with best practices. And we see ourselves as a part of Annenberg that really has a very close relationship with what's going on in the field, where we can connect with the public in new ways and experiment in ways with our own journalism projects and in our training that brings all this together and really breaks some new ground. We also really believe that health reporting is local reporting, and that some of the ways that health can be viewed are really much more expansive than the healthcare industry, for example. So some of the best reporting that we have supported takes a look at health in this way. And it looks at how issues like poverty, opportunity, race, education, community safety, transit, and the built environment all contribute to health or ill health. And if this sounds a little bit like a lot of buzzwords, let me put this to you a different way. There's a scholar at the University of Michigan named Arlene Geronimus, and she's coined a term called weathering for the premature aging that can come from living in a community where you're subjected to chronic stress. And one way to think about this is in the context of African American men and their life expectancy and how short it is compared to Caucasian men. Another way to think about this is in violent neighborhoods in America, you might think your biggest health risk is a bullet. That's not really true. It's chronic disease. That comes from chronic stress. It's hypertension, it's stroke, it's obesity. You can't find fresh food somewhere. It's you're not exercising. It's all these things that are connected with where you live and the opportunities or lack of opportunities that are presented by being there. And so we think this kind of reporting is a really great way to get the attention of policymakers and make a substantial difference. And we've seen this happen with some of the reporting that we've supported. We're also really interested in community engagement, and I mentioned that Boyle Heights Beat is something of a laboratory for us. So let me just walk you through something that we did a couple of Saturdays ago. This is a picture from a community forum that we had, and it was built around a story written by a young high school student named Dulce Morales, and she featured this adorable girl, Sharon, who actually stole the show, talking about her own battle with weight, and a really wonderful program offered by a local clinic. And we brought together a trainer who showed people simple exercises they could do at home with a chair, which is what they're all doing right now. We were dancing merengue and doing exercises. We had the chef who supplied the food talking about, the recipes she used, and Sharon, this young girl, talking about, her own thinking, which was remarkably clear and well thought out on how she was managing her life. And so to get people here, we engaged in a kind of almost old-fashioned advocacy campaign. I mean, we went to neighborhood watch meetings, we went to the Dolores Mission, we went to the neighborhood council, and we stuck a flyer in every public housing mailbox to really get people who are disconnected some information they need. This is the second such forum that we've done. Our first one was on health reform, and it really, in our mind, creates a role for us as an information provider in a really different way that can unite our print product, our physical presence in the community, and our online work too, because Albert Sabate, who I'd like to acknowledge, who's a member of our team, is making a video about some of this that will also go on the website for Boyle Heights Beat. So, and then, we keep talking to our reporters about reporting with impact. We mentor them. They spend a week in our training program, and then we mentor them for 6 months to help them produce the projects that we support. And this one on the left is a project that was just published in the Detroit News called Surviving Through Age 18, that documented with a lot of intensive data research that Detroit is in fact the most dangerous place to be a child in America. And it brought a swift and dramatic response. The mayor is saying he's going to do things in response to this. All the public health agencies are talking. The reporters being featured on media all over the state. On the right, you see a picture of a woman from a project that was done out of the Billings Gazette about suicide, and something that everyone sort of took for granted, which is that the state has the highest suicide rate in the country, but no one really did anything about. She embarked on what became a year-long project on this. The governor called her when signing new legislation and thanked her for her work. There's been new cultural programs launched, new public health trainings. It's saving lives, I'm convinced. And then the project on the left, this little boy, is a project about the health effects of family separation due to deportation. And it was published in Mundo Hispanico, a Spanish language paper in Atlanta. And we also have another project about loneliness and the health effects of loneliness in the Deseret News that I've included in some of the stuff I handed out, that's also really gotten a really interesting response. This is a project out of the Riverside Press Enterprise year-long investigation into how the development policy of Riverside, which is investing in these mega warehouse centers that bring diesel particulate matter into the air at really high densities near schools and so on, is really contributing to the poor health outcomes for children and others. This is a project by Becca Aronson looking at the constricting of women's ability to get any kind of abortion services in Texas. It's been a kind of dramatic example of where all this is happening in some of the more conservative states in the country. And this was a project that involved a bunch of reporters, including some of our former fellows elsewhere, about the health and other impacts of dropping out of high school. That also involved a very intensive community engagement campaign. Our fellows have won a lot of awards, and they're really happy about that. But I think that the most important thing is the kind of impact they've had. And I'm going to talk a little bit about one of our projects because I think it shows the potential of both these collaborative models and these models where you're trying to really engage the community in a different way. This is a little nod to our program from the Columbia Journalism Review for our first collaborative effort, which looked at valley fever. And as I think I mentioned, valley fever is an airborne fungus, and when you stir up dust or there's dust storms or whatever, you can get it. The project was called Just One Breath, because all you have to do is breathe. I mean, you could get it driving through the Central Valley, although you'd be at greater vulnerability if you live there, obviously. And so these are the outlets we brought together, all former fellows in our program who were uniting and leveraging together. We ended up working on this project for about 9 months. And you can see these are some of the community engagement efforts that one of our reporters doing. That was very much a part of the project. And we very systematically went through and looked at what are some of the issues that are not being addressed here, including a roadmap. Like, this is a roadmap policymakers could take to really make a difference here. We later heard through our independent evaluator that Republican whip Kevin McCarthy printed out these articles and sent them to the CDC and the NIH over the summer and said, you know, you guys have to do something. And in a pretty unprecedented event, he brought out the heads of the CDC and the NIH to Bakersfield and held a 2-day convening on this this whole epidemic, in which the two agency heads committed a multi-million-dollar grant to a research trial on treatment protocols that had been, 50, 70-year-old treatment protocols. So the other part of the story is that once we got going, some of the researchers at the CDC who we worked with closely started publishing more. That prompted national coverage. Our coverage got, like, the New York Times interested, the BBC, and we contacted them, and we continued this collaborative model. You want some sources? We said to the New York Times, here's a couple. BBC, you want our lead photo? It's yours. And from our standpoint, this was just adding to the attention, and we wanted to encourage what would typically be seen as a competitor. So that was a new model for us, too. And basically, we're just really continue to be really excited about the potential of this model. We're working on a new project looking at immigration and health. It's a bilingual project for which we built a Spanish and English language microsite. It involves Univision here in LA and in Arizona, Mundo Hispánico, Radio Bilingüe, and a bunch of other partners, WUSA Pittsburgh, again, all former fellows in our program. And we'll keep you posted on what comes next. So thank you so much for your time.
How long do you continue to own these stories? I saw the New Yorker, their local correspondent, right, had a massive piece on this topic that I saw you and your fellows talk about a year ago. Do you stay on it, or you now have to move on once the laws have been changed?
Well, we're sort of, what I would say is that there was some momentum. There was this CDC convening, NIH convening. We feel like the issue has moved to the front burner. We continue to cover it, but not as intensively. There's some other elements to this story. For example, in terms of our impact, I just mentioned the CDC, NIH, but also the California prison system has ordered the state to stop sending prisoners to the Central Valley, to two of their facilities. I'm sorry, not any prisoner, African-American prisoners, because they, for reasons that are not fully understood, African Americans have a higher vulnerability. And one of the stories that we did in September 2012 documented that these prisoners go in for whatever, cocaine offense or who knows, whatever, and they end up with a life sentence of this horrible disease, and you can even die from it. The most recent story on it was an AP story about some prison workers dying from working in the Central Valley. You know, we just had a blog post about it. We used it to write a kind of editorial style blog post to keep the flame burning, and we think that some of our key partners are also, we're still in touch with them about all this. It's not going to be as active, and if other people are doing stories on it, we just feel like basking in the glory, you know. But I think, I don't know that we would follow something like for years. Out of this project, another kind of funny, I don't know if I'd call it community engagement in the conventional sense, is that we developed a very interesting relationship with the CDC. And they had us participate in a special page that they created on Valley Fever that links to all our content, uses a lot of the phrases like just one breath that were part of our, you know, branding, I guess. And we continue to get a lot of traffic from that CDC site. We also did things where we called for community storytelling. People called us, we produced stories out of that, and those features on the site continue to get a lot of traffic, probably, interestingly, in some ways, more traffic than our policy pieces.
One follow-up.
Mm-hmm.
Do you rely just on the blog that you mentioned on the site, do you only work with traditional journalism professionals, or do you work with medical professionals, doctors, community members? Who are your reporters?
So for the collaborative projects, the two collaborative projects have involved newsrooms. And so those are, you know, journalists working for mainstream and ethnic media, print, online, broadcast journalists. But we've done a lot to experiment with these community engagement techniques in these projects too. In each case, we had a dedicated community engagement person in addition to the reporting team. And so we're drawing in the community stories and we're featuring them and we're profiling them in some different ways. And then on our website, we're also, reporting on health website overall, we're trying to get more voices into the sort of policy debates and other discussions about journalism and health, because we don't think it's so good for journalists just to talk to themselves. And so, for example, we have a new healthcare blog called Remaking Health Insurance, and one of the bloggers is the medical director for a clinic in San Francisco that cares for the homeless. And she writes with a really unique perspective. We also have another collaboration that we just got underway between a journalist who heads up a blog on children's health and two teams of researchers at Children's Hospital LA, which is actually affiliated with USC, so that they can write about the community-based research they're doing that's trying to, for example, stem childhood obesity. And we're expecting an upcoming blog about work they're doing in churches. So they're trying kind of interdisciplinary approaches in their own research, and then having it featured on our site is another way to kind of really experiment. And so we're just getting underway that kind of conversation too. And then we have another one coming up with environmental policy think tank, you know, blogging for us too, a bunch of principles. So it's been an interesting way to open up the conversation.
Following up on the prior question, it's interesting to think about the connection between your work and what is thought of as being the social marketing model. You know, the question becomes, for how long, and it's been asked, for how long can these be sustained? Because when you think about certain implacable problems like obesity, diabetes, you know, certain teenage communities, that has to be sustained over a long period of time before the campaign, let's say, has to be sustained over a long period of time before it can have a real effect at a community level. So might there be a way to build in, you know, our expertise, let's say, in social marketing, health marketing, as part of your overall mix of expertise?
Yeah, no, I think that would be fantastic. I mean, for example, right now on this one on immigration and health that we have somebody who's doing all our social media who has a unique skill set, which is she's from Venezuela, so she's 100% bilingual. So she's doing her Facebook and Twitter in both languages. she's also a former radio reporter at KPCC, so she's interviewing the journalists who participate in the project, and we're putting that online. We're also experimenting with doing surveys, community surveys on our Facebook page to find out whether people's immigration experience, is what it's like, immigration and health, where we could try and then write stories about that. But we would love to involve you guys and get, maybe one of your, I don't know if you have like a research internship or something, but I think there would be some fantastic opportunities there for both of us. You're in.
Have you guys ever done anything with the Lear Center?
In terms of formally, no. I mean, the one thing we did is we involved Johannes Blakely in this event we had where we invited foundation leaders and journalism leaders to come together to talk about better reporting on underserved communities. She was a presenter, but we haven't had formal collaborations.
It seems to me all the stuff that they're doing and all the stuff that you're doing, that be a natural fit there. They could, you could report on what they're doing, they could incorporate you into something.
Yeah, I mean, they're Hollywood Health and Society.
Health Society is one that I'm thinking. So I would just encourage.
Yeah, no.
Thank you much, Lee.
Yeah, thanks.